All right, we'll go ahead and get started. Welcome to the next webinar in the Mental Health Support for Students during COVID-19 series. Tonight, we'll be talking about anxiety, depression, and suicide prevention. So if this is your first webinar in this series, a little bit about me. I'm Sarah Underdahl. I'm a licensed independent clinical social worker, and I work as a therapist with the Scott County Mental Health Center within the CONNECT program, specifically in the Prior Lake, Savage, and Jordan School Districts. The CONNECT program, if you're not familiar, is a program where students are able to get therapy services during their school day within their school building. Typically, it would be within their school building. Currently, most of those services are taking place virtually just due to precautions and restrictions with COVID. My contact information is on this slide as well. So there's my email. That's the best way to reach me if you have questions after this presentation. You also all should have received the invite from my email directly, so you can also just respond to me at that email. A few things to know before we get started. As you entered the room, your mics were muted just to make sure that we're not picking up any background noise. But you should be able to unmute to ask questions, or you can also ask questions through the chat feature, which on a computer should be in the lower right-hand corner of your screen. If you are on a iPad or a cell phone, it might be in the upper right-hand corner, but it'll be a box that just says chat. And so you can type questions there. Know that the questions that are submitted in the chat are kind of automatically, they'll go to all the participants. And so if you have a more kind of specific question or a question that you really would prefer to ask privately, you can send me an email with that question and I'll respond through email. If we don't have time to address all the questions that you have, again, just feel free to reach out to me after the presentation, or if you think of other questions after the presentation has ended, I'm definitely open to answering questions through email. And then just kind of something to be mindful about before we get started. For some people, this topic can be really sensitive or just bring up difficult times for people and difficult emotions. And so really just make sure that you're taking care of yourself. If you need to step away from the presentation or leave, that is okay. Just really be mindful of what you need. And if you maybe need some support afterwards as well, make sure that you are taking care of yourself. So tonight we'll be talking about anxiety symptoms, depression symptoms, how to support your child, when to seek help, risk factors and warning signs for suicide, talking with your child if you are concerned that they maybe are at risk for suicide or are having suicidal thoughts, and then crisis resources. So starting with anxiety, when I say anxiety, I mean generalized anxiety disorder. We'll go through some other anxiety disorders as well. So anxiety is a really common disorder in children and teens. 7.1% of children aged 3 to 17-year-olds, or approximately 4.4 million children, have diagnosed anxiety. 1 in 3 teens meet criteria for an anxiety disorder by age 18. And then with these symptoms that we'll kind of discuss on the right-hand side of the slide, know that everyone experiences stress and anxiety sometimes. You might recognize some of these symptoms in yourself when you're experiencing just a day where you're feeling anxious or are feeling really stressed out about something that's kind of coming up. But it really becomes a mental health diagnosis when anxiety is occurring too often, is too strong, or is out of proportion to the present situation. And if you're noticing that it's really affecting someone's daily life and happiness. So it's really getting in the way of daily routines, it's getting in the way of work or schoolwork or relationships. That's where it really becomes like a mental health diagnosis. So symptoms of anxiety are excessive anxiety and worry, more days than not, for at least 6 months. Worry can be around, like for children, it could be around school performance, it could be around relationships with others, could be just kind of fears about like what's happening or what could happen to people that they love. So it can really be kind of a broad range of things. That's where like the generalized anxiety comes in. These are people that have a hard time controlling the worry. So maybe they know that this worry is not really in proportion with the present situation, but they're still not able to control it. It really kind of takes over their thoughts, and it's really difficult to cope with. Other symptoms that you might notice are restlessness, like fidgeting, or just lots of kind of engaging in lots of movement, fatigue, even when your child is getting enough sleep at night. They're still feeling tired throughout the day. Difficulty with concentrating. It can be hard to concentrate if you have all these worries that are constantly kind of running on a loop in your head. Sometimes rather than expressing worry or anxiety, kids will display more irritability. And so sometimes even if your child isn't maybe explicitly saying that they're worried or are experiencing anxiety, they could be, and it's coming out more as irritability for them. They also might experience muscle tension, sleep disturbance, so difficulty falling asleep or staying asleep at night. And then anxiety sometimes is also expressed in more physical symptoms. So if your child is talking about experiencing frequent stomach aches or headaches, maybe you've been to the doctor's kind of ruled out a physical cause. Sometimes that can be due to anxiety or another mental health diagnosis. Panic attacks sometimes, but not always, occur in people that have an anxiety diagnosis. So within a panic attack, it's repeated episodes of sudden and unexpected intense fear. And typically they last for a pretty short period of time, but they're really intense during that time. So typically they resolve within a couple of minutes, but it feels really intense to the individual that's experiencing it. They might have difficulty breathing. You might notice that they are hyperventilating. They might experience pounding heart or an accelerated heart rate. They might report feeling really dizzy or they're sweating. They might experience chest pain or chest discomfort. They might feel nauseous. You might notice that they're shaking or trembling. So this is, again, just really kind of intense periods of panic and anxiety that sometimes can occur with anxiety, but not always. So social anxiety is specifically kind of in social situations. And so this is something that impacts nearly 5% of children and teens. And of all anxiety disorders in teens, so teens that have anxiety disorders, 9% of them have social anxiety. Typically, the age of onset is 13, but it can be before or after that time. And globally, social anxiety is the third most common mental health concern. So symptoms with social anxiety are significant, excessive, and persistent anxiety in social situations. Your child might avoid social situations due to the anxiety that they're experiencing. They might have fear or worry of being rejected, judged, or being made fun of by others. They might have a hard time talking to, speaking up, or making eye contact with people that they don't know. They might seem extremely self-conscious. They might isolate socially. You might kind of notice them withdrawing. They might have a hard time making friends due to this anxiety and worry around interacting and talking with others. And they might experience intense anxiety if they're called on in class or if they're required to give a presentation at school. So things that you might notice with anxiety, because anxiety is this internalizing mental health diagnosis, so it's something that someone is really experiencing on the inside, you might not always know kind of what they're experiencing or that they are feeling anxious or worried frequently. So some things that you might observe in your child if maybe they are experiencing anxiety is feeling really overly anxious to fit in. So they seem really preoccupied. Of course, it's normal for preteens and teens to be preoccupied kind of with their friends and with fitting in. But when it appears to be maybe kind of more than the norm, that can be kind of a signal of anxiety. Children that are perfectionists, if they have a really hard time with making mistakes, or you notice that they really redo tasks if they're not perfect, kind of in their mind the first time. And sometimes this can lead to irritability if they're doing tasks over and over again, or maybe if you're trying to provide reassurance that, no, that looks great, or you did a great job, sometimes this can lead to irritability as well, and so you might notice that. They might spend a lot of time doing homework, like again, more than they would need to based off of the work that they need to do, just because they're really trying to not make mistakes and focusing on that. Sometimes you see the opposite effect. So because they are procrastinating on tasks because they just feel like, well, I can't complete them perfectly and I can't do this without making mistakes. So I'm not going to try because it's not going to turn out the way that I want. So sometimes you kind of see the opposite end of the spectrum. They might lack self-confidence, or you might notice that they engage in a lot of self-criticism. They might put themselves down frequently. They might really strive for approval or look for a lot of reassurance around their performance. They might complain often about headaches or stomach aches, and they might avoid going to school or avoid social situations due to the anxiety that they're experiencing. So with depression is something that 3.2% of children aged 3 to 17 years old have diagnosed depression. And approximately 20% of teens will experience depression before adulthood. So this is another common mental health diagnosis in children and teens. Depression increases a teen's risk for attempting suicide by 12 times. And so this is why later in the presentation, we'll talk more about kind of those risk factors and warning signs to be aware of. And then between 10 and 15% of teens have some symptoms of depression. Symptoms of depression include feeling sad, hopeless, empty, or irritable most days for at least 2 weeks. So again, some days it comes out as sadness or you notice tearfulness in your child, but sometimes it comes out in irritability. You might notice a change in appetite, so they're eating much more than they used to, or they're eating much less, or reporting that they're feeling a lot hungrier or that they don't have an appetite anymore. They might have less interest and enjoyment in activities. You might notice a change in energy level, change in sleep patterns. They might feel really restless, so you notice a lot of fidgeting and movement, or the opposite, you might notice that there's a drastic change in how quickly they're moving. So they're moving really slowly enough that you would notice, or their speaking is slow enough that you notice a change. They might experience difficulty concentrating. They might experience thoughts of death or suicide, or frequently talk about death, and just have difficulty with feelings of worthlessness. So again, depression is another mental health diagnosis that is really an internalizing disorder. And so some behavioral signs that you might see if your child maybe isn't talking about kind of how they're feeling, you might notice that they seem to cry kind of out of nowhere for no apparent reason. You might notice angry outbursts or disruptive or risky behaviors or other kind of acting out behaviors. You might see them not engage as much in activities or relationships. So maybe they used to be really interested in sports, but they just have been kind of withdrawing lately, or they used to be really engaged with their peers and their friends. And again, they're just not showing interest in that anymore, and they're withdrawing and isolating themselves. They might show a fixation on past failures, or show, again, that self-criticism, kind of putting themselves down frequently. They have a hard time seeing their strengths. They might show sensitivity to rejection or failure. And then you might notice that they have a hard time thinking or concentrating, making decisions, remembering things. They might talk about death, dying, or suicide frequently, or show kind of an interest in this. And then you might notice just them being fatigued and not having very much energy frequently. There also can be a difference in their sleep. So they're sleeping too much, or they're awake frequently in the middle of the night. They have difficulty sleeping. You might notice change in appetite, weight loss or weight gain. Sometimes individuals with depression use alcohol or drugs to kind of try to self-medicate. You might notice agitation or restlessness, so kind of that really engaging in a lot of movement or pacing, having a hard time sitting still, or like I said, it can be the opposite where their movements or their speaking are so slow that you're noticing how slow and different it is than their previous. Sometimes there's also an effect on school performance because of this loss of interest and just having low energy and low mood. Sometimes school performance changes, or there's frequent absences from school. They also might have more trouble with self-care tasks and personal hygiene, or begin to appear to care less about their appearance, or you might notice self-harm like cutting or burning. So if you are noticing kind of any mental health symptoms or any of the symptoms that we talked about, thinking about how can I talk with my child about these concerns. So first, being really mindful about when you're choosing to talk with your child, thinking about a time when they're probably going to be most responsive. So for some kids, maybe that's like right after dinner time or at lunchtime. For some kids, maybe it's right away in the morning, but likely for a lot of kids, it's not because they're just kind of still waking up. They're probably not in a great mood and kind of ready to engage in this conversation with you. So thinking about when the right time is for your child. Next, just being really prepared for how the conversation might go. It's possible that this will really open up communication and they'll feel comfortable, or they might be experiencing some kind of shame and embarrassment about the symptoms that they've been experiencing. And so they might become more irritable. And so just kind of being prepared yourself either way to respond in a calm manner, regardless of how your child responds to you. So starting by sharing your observations and concerns. So specifically, what have you observed? And there'll be some examples of this on the next slide. Whatever your child is sharing, it can often be really difficult sometimes to not want to jump to, I just want to fix this for you because I care about you. And so really trying to first just join with them in the difficult feelings, validate their experience. You might ask them, what's that like for you? Or ask them to tell you more about their experience. So first starting with that, just kind of trying to join with them in these difficult feelings. If your child is displaying more anger or irritability, it can sometimes be helpful to try to connect with what's maybe underneath this anger. Sometimes it's helpful to think of anger like an iceberg. And so anger is up here, this is what we're seeing, but what's really underneath the surface of that? Are they feeling really scared? Or are they feeling really sad or embarrassed? And trying to connect with that feeling, if you're seeing more of the anger, empathy, sometimes that can be helpful. Trying to avoid blaming or shaming language or just kind of dismissing what they're sharing with you. Trying not to overwhelm them with too many words. So really trying to maybe make one statement or question and then just allowing kind of wait time for them to respond. Sometimes I like to even count to 10 in my head, just to allow, it feels like a really long time when you're doing it, but just to really allow that time for processing and for them to kind of come up with what they want to say. And then just leaving the door open for communication in the future. You may offer them alternate ways to communicate if you feel like maybe they would respond better to like being able to text you or email you, kind of based on your comfort level. But just letting them know, maybe saying something like, it seems like you're not ready to talk about this right now. Like, I care about you and I'm going to be here whenever you're ready. So some other examples of how this conversation might go, things that you might say. You seem down lately. How are you feeling? Would you like to talk about it? I'm here for you. And again, giving that wait time. So you're probably not going to say all of that at once, but just kind of some examples of what that might sound like. It's normal to feel stressed, but if it feels like that all the time, we should talk about it. I care about you. You are important to me. Let's make an appointment to talk with someone about how you are feeling. So if kind of during this conversation, your child is sharing just that they're experiencing a lot of difficulties, that's where you might let them know that it's time to pull someone else in for support. So when to seek support? Again, the big thing is if it's interfering with your child's daily life, so it's really affecting their school, their like engagement with school or just their ability to kind of concentrate and engage with that. Things at home maybe are tense or there's more conflict. If it's affecting friendships or their sleep or their eating. If they're feeling really extreme depression, fear, anxiety, or anger towards themselves or others. If it feels really out of control for you or for them. If they're hearing voices that other people don't or seeing things that other people don't. If their behavior is concerning to others, so whether that's concerning to you or maybe their friends have brought concerns or other kind of staff at school have brought concerns. If they are reporting that they're experiencing suicidal thoughts, and we'll talk more about that in a little bit, or if symptoms have been persisting for a long period of time, like weeks to months. Because again, it's normal for people to experience difficulties for shorter periods of time or kind of some days more than others, but if it's really persistent for a long period of time, that's when it's time to seek more support. So some facts about suicide. Suicide is the 10th leading cause of death in the US for all ages, but the second leading cause of death for 15 to 24-year-olds. 1 in 100,000 children ages 10 to 14 die by suicide each year, and 7 in 100,000 youth age 15 to 19 die by suicide each year. So risk factors for suicide are their characteristics that make it more likely that someone would consider or attempt suicide, but they by no means cause or predict someone's kind of risk of attempting suicide. They're just important things to be aware of as we talk about this. So some risk factors for suicide are alcohol and other substance use disorders. When you're using substances, your decision-making is impaired. If they're experiencing hopelessness, if they have impulsive or aggressive tendencies, if there's a history of trauma or abuse, if they have major physical illnesses, previous suicide attempts, increase the risk just because if someone has already crossed that line, they might do so again. Family history of suicide, if someone is experiencing job or financial loss or other kind of large losses in relationships or ending of relationships. If there's easy access to lethal means, such as like guns or other weapons. If there have been local clusters of suicide, so this is something that someone is seeing and it's maybe being normalized in kind of some way because they're seeing this more frequently. If they have lack of social support or are feeling really isolated, if there is stigma with asking for help, they feel like maybe this isn't an option for them to ask for help. If they lack health care, especially mental health and substance abuse treatment, so that support maybe isn't available to them. And then exposure to others who have died by suicide in real life or through the media or the internet. So warning signs are things that you might see that can help you to determine if someone is at risk for suicide. So these are where if we're seeing these things, we really want to talk with the individual and assess further and get them more support. So number one is someone that is talking about wanting to die or wanting to kill themselves. It's really important that we take that seriously whenever a child or a teen or an adult is making statements like this, whether it's they're verbally expressing this or maybe they're making these statements on social media. So always making sure that we're taking this seriously and asking them more and trying to get them support. If someone is, you notice that someone is like looking for a way to kill themselves, like they're searching online of different methods, if they're talking about feeling really hopeless or making statements about not having a reason to live, if they're talking about feeling really trapped or feeling like they're in unbearable pain and they just want that pain to stop, if they're talking about feeling as though they're a burden to other people, If you notice that they're giving away possessions or saying goodbye, or a conversation just maybe doesn't quite sit right, it feels like it was very final, really follow your instincts there and check in with that individual. If they are increasing the use of drugs or alcohol or new use, they're acting really anxious or agitated or behaving really recklessly, kind of showing that they maybe don't have as much care for their life than they have in the past. If they're sleeping too little or too much, they're withdrawing or isolating themselves from kind of supports and relationships that have been helpful in the past. If you're noticing really extreme mood swings. So some things that people might say, or statements that are kind of red flags that mean it's time to ask this person if they need more support. So things like nothing matters. I wonder how many people would come to my funeral. Sometimes I wish I could just go to sleep and never wake up. Everyone would be better off without me, and you won't have to worry about me much longer. So those are just examples. And some of those are more like what we call like passive suicidal statements, but even things that are passive, we need to look into more and assess. So if you're noticing some of these warning signs with your child, how can you support them? So we'll kind of go through and talk about like general kind of recommendations, and then we'll go through specifically kind of what this conversation might look like and specific things that you might say and do. So number one, being really direct and talking openly and matter-of-factly about suicide. Actually asking the question, are you thinking about suicide, or are you thinking about killing yourself? Trying not to, even though it's really difficult to ask that question and have this conversation, trying to be as direct as possible. Being willing and open to listen, allowing them to express their feelings and accept those feelings. Again, it can be really difficult, especially if it's someone that we care about, that they are expressing these things, that they're in so much pain, and we might want to jump to trying to reassure them of like, well, I know that things are going to get better. But really in the moment, just trying to accept their feelings and allow them to express those feelings openly. And then being non-judgmental in what they're sharing as well. So get involved with them. Of course, if this is your child, being involved, but if it's someone else in your life, getting involved, becoming available, showing your interest and support, checking in with them, letting them know that you're a supportive person who wants to help them get the support that they need. Try not to act shocked. It can be, again, really difficult to hear this from someone that we care about, but really trying to stay calm and level, because if we maybe act really surprised, it can put this distance between you and make this person feel like, well, maybe I shouldn't have shared this, or this was too much for them. And so really trying to be calm. Making sure that if someone is saying, well, don't tell anyone, or maybe your child is saying that their friend told them that they were thinking about suicide, but they said not to tell anyone, letting them know that this is not a secret that can be kept because you care about them. You can offer hope that there are alternatives available and that there is support out there, but just being careful that you're not dismissing their feelings. So saying, like, I'm going to make sure that you get the support that you need, or I'm going to help you to get support, but not dismissing the feelings that they're experiencing. And then taking action, so doing things like removing weapons or pills that they could use to end their life. And then also getting professional help from agencies that specialize in crisis intervention and suicide prevention. So action steps in terms of specifically what this might look and sound like. So start by opening up the conversation by sharing the specific signs that you've noticed. So you might say something like, I've noticed lately that you aren't interested in soccer anymore, which you used to love, or you're posting a lot of sad song lyrics online, and I'm feeling worried. And so then you might actually ask the question. So starting with, are you thinking about suicide? Next, you might ask just to kind of assess how much they're thinking about suicide, if they're saying yes, or even if they're saying, well, I don't know, or maybe sometimes, any kind of like affirmative answer, or even saying no, but seeming maybe not quite sure of that no, means that we need to assess further. And so next questions might sound like, do you have a plan? Do you know how you would do it? When is the last time you thought about suicide? And so if the answer to that first question is yes, you know already that you're going to seek help. But these other questions can just kind of help you to know like how immediate this concern is, and how, if this is something that like they're about to try. So listening, expressing concern and reassurance, you might say things like, you're not alone, I'm here for you. I might not be able to understand exactly how you're feeling, but I care about you and I want to help. I'm concerned about you and I want you to know that there's help available to get you through this. You are important to me and we will get through this together. So those are statements that really provide that concern, that reassurance, that active listening without kind of dismissing what they're feeling. If someone is saying that, yes, they are thinking about suicide, and especially if they have kind of an active plan, make sure that you stay with the person. Or if you're not able to, maybe you're calling for extra support. Make sure that they're with someone else who's aware of the situation, and who's going to make sure that they're safe until you can get further help. You can remove any objects that could be used in a suicide attempt and remove any potential means like weapons and medication to help reduce the risk while you're waiting for extra help. And then you can call the National Suicide Prevention Line, the Scott County Mental Health Center, or the Scott County Crisis Program for further assessment, particularly if maybe your child is saying like, yeah, I've thought about it before, or yeah, I'm thinking about it, but I don't really have a plan. You can call those people for further assessment and they can kind of recommend next steps and what you should do. And they know more kind of about how to assess for this and what questions to ask. If your child is really talking about a specific plan, they have this intent, they want to end their life, that's where you want to call 911. Or if it's safe, you can bring them to the ER for assessment and intervention. So things not to do in this situation: don't promise secrecy. If your child or your child has a friend that's maybe asking you not to tell anyone, you might say instead, I care about you too much to keep this kind of secret. You need help and I'm here to help you get it. Don't try to debate or argue with them in this moment. They're not in a place where they're able to take in that information. They're feeling really depressed. Don't ask in a way that indicates that you want no for an answer. So again, ask the question, are you thinking about suicide or are you thinking about killing yourself? You don't want to say something like, you're not thinking about suicide, are you? Don't try to handle the situation alone. Again, rope in other professionals, rope in if maybe you're calling someone for extra support, try to get someone else to stay with the individual so that you're not alone in dealing with this, because it is really difficult and will probably bring up a lot of emotions for you as well. And then other things not to say, we don't want to say things like, we all go through tough times like these, you'll be fine. Or it's all in your head, just snap out of it. Again, anytime that someone is talking about suicide, we want to make sure that we're taking that seriously. So this is kind of those steps just laid out in a visual, but I like this because it's pretty, simple as a visual. So first, ask, are you thinking about killing yourself? Next, keep them safe. So reducing access to those means, like guns and pills. be there with them, stay with them, help them to connect to resources, and then stay connected. So if someone is like admitted to the hospital due to a mental health crisis, trying to follow up with them after they're maybe discharged, at checking, continuing to check in with them and show that you care. And then here are some different crisis resources. So there is the Scott County Crisis Program that's available for all residents in Scott County. That phone number is there. They provide assessment and then kind of referral and recommendations to further resources. The Scott County Mental Health Center during business hours does the same, so can also do kind of those crisis assessments. The National Suicide Prevention Lifeline is available to everyone in the US. And so that's a number, again, you can call. They can provide some assessment of the situation and then recommendations for next steps. Even when if someone is calling these resources, you would still want to stay with a person during that time so that you have someone kind of still physically there with them. And then if harm appears imminent, call 911 or bring your child to the ER. And then there are some different resources.